everyone, my name is Tony. I am hosting this event from ErgoFlex Technologies, who is the home of the Back on Track and Knee on Track. For those of you who do not know Dr. Barlow, I'm going to do a quick bio and then we'll get right into tonight's topic. Dr. Andy Barlow is a board certified functional neurologist who holds a diplomate in functional neurology. For over 20 years, he has run a thriving practice in Tupelo, Mississippi. He's the author of 2 #1 new release books on Amazon, License to Heal and Highway to Health. Dr. Barlow is known for taking on complex cases and creating miracles in his clinic every day. His mission is to make functional neurology so simple that even a patient can understand. He loves teaching doctors how to get out of the daily grind and stop being a slave to insurance. He recently opened the Barlow Brain and Body Institute. Please welcome Dr. Andy Barlow.
And well, Tony, I want to thank you very much for that intro. And what we want to do is we want to get right into the knee pain or knee function. One of the areas that's overlooked that we have to deal with is what is called the neurokinetic chain, which means when we're dealing with a knee problem, we want to look at the lumbar spine. And I'm not going to bore everyone with the entire lumbosacral plexus, but there's just some important points that we need to go through here. And I'm going to go through this rather quickly. And the reason is this is being videotaped, so we can review it again. So what we want to talk about here is really at L2, L3, L4, and here what we have at L2, 3, and 4, we have what is called the femoral nerve. And with this femoral nerve, we have several different muscles that we actually have to address. And when we go through this, I want you to understand that, of course, we all know this that's watching because we're doctors. We have 5 nerves that come out of the lumbar spine. However, patients don't know this, and they won't know this unless you tell them. So we have 5 nerves that come out of the lumbar spine. 4 of these nerves control your knee function. So L2, 3, and 4, which make up the femoral nerve, control the front part of your knee. The obturator nerve, which we're not going to draw out today, control the muscles on the inside of the knee. And L5 actually controls what is called the popliteal muscle, and it goes to the tibial nerve. And I'll go through this briefly. So if we have any type of issues, meaning degeneration at L2, 3, or 4, we can actually have problems with the transmission of the femoral nerve, sensory or motor. Now with this, one of the areas that we want to talk about here is going to be the sartorius. And this is the muscle that's going to be part of the pes anserine. And the pes anserine, which we're going to talk about, is one of the areas that's most overlooked in the knee joint. All right. So we have our quadriceps, which is the rectus femoris. All right. And then we have the vastus medialis. We have the vastus lateralis. And then we have the vastus intermedius. All right. Now, so these 4 muscles here make up what is called our quadriceps. Now, from a neurological standpoint, these muscles, the rectus femoris, vastus medialis, vastus lateralis, and the vastus intermedius, they have what are called receptors. And these receptors are muscle spindles and Golgi tendon organs. And neurologically, if a patient has knee pain, we want to activate these muscle spindles and or Golgi tendon organs. Now, this system that I teach doctors, which will be upcoming in Conroe, Texas, let's see, March the 18th, 19th, and 20th, which I'll show you here in just a minute. We're going to go through all the muscles in the lumbar and the lumbar spine and lower extremity, hip, knee, and foot. Now, these receptors are muscle spindles and Golgi tendon organs, and part of their job is to inhibit pain at the spinal cord level. And this neural reconnect system, the reason we're able to accept patients for care if we help them within 2 visits is because they have a knee problem and we know how to activate these muscle spindles and Golgi tendon organs in the knee. Then we actually can get results with these patients, over 90% of these patients, within 1 to 2 visits. And if we get these results, we will actually accept the patient for care. So how great would it be to actually have a program that is so successful that we can help over 90% of patients with these problems by activating these muscle spindles and Golgi tendon organs. And if we don't help these people, then we just refer them out. Okay. It makes my life easy. It helps me sleep at night because I only accept patients that I know that I can help with care. So off this femoral nerve, there are more muscles that come off here. But the one that we want to focus on with the knee is our sartorius, rectus femoris, vastus medialis, vastus lateralis, and vastus intermedius. Now, off this L2, 3, and 4, we also have the obturator nerve. And these muscles here have to do with our adduction. So it adducts our hip. One of the muscles that we want to deal with here is called the gracilis. And this gracilis is part of the pes anterine, which is in the medial aspect of the knee. Now, if you take x-rays and you actually look at a person's knee with chronic knee pain, most of these people, and I do mean in the high 90 percentile, are going to have problems with the medial aspect of their knee. The medial part of their knee is degenerated much more than the lateral side of the knee. And what happens in this situation, this pes anterine, these three muscles that make up the pes anterine, the sartorius, which I talked about here, gracilis, and then the semitendinosus, which we'll talk about shortly. These muscles, these three muscles come in on the medial side of the leg, and they have to carry the brunt of this dysfunction of the medial knee and its degeneration. And if you actually palpate this area of the knee, people would just about jump off the table, the exam table, when you're actually palpating this area. So the knee joint itself hurts, but this bursa and the three muscles that go into this pes anterine, the sartorius, gracilis, and the semitendinosus, become the tendon area in the bursa becomes intensely inflamed here. And if there was a secret to the knee, this would be one of them. We actually have to treat the pes anterine, and we have to know these muscles, their functions, their origins, their insertions, and actually how to treat this. And again, I go over this at my seminar in my lower extremity door reconnect system. Now, as we get down to L5, and I'm gonna just make this as easy as I can. The sciatic nerve is made up of two nerves, common peroneal and tibial nerve, and that the branches, the nerve roots from that are from L4, L5, S1, 2, 3, and 4. I'm not going to draw all this out today. At my seminars, I do, because we have to know how to correct all of these muscles in the lower extremity. Now, at L5, this is going to make up what is called the tibial nerve. Now, this tibial nerve, what it's going to do is at the knee, we have a muscle that's called the popliteus. And this popliteus, okay, is the muscle. If you actually Google popliteus, it will say, this is the muscle that unlocks the knee. So whenever you take a step, something has to unlock the knee. I'm sorry, I guess somebody wasn't muted. That's okay. So, we have a muscle that actually unlocks the knee, and this muscle that unlocks the knee is called the popliteus. Okay. Now, what's important here, literally had a patient come in this afternoon with this problem, and she said, I have this pain. Okay, somehow it said I just was muted. I just unmuted myself. So what will happen is the patient, when they have this popliteal problem, typically has pain in the inferior aspect of the patella. The reason for this is not only does the popliteus unlock the knee, the popliteus, when we actually plant our foot, keeps the femur from actually shearing on top of the tibia. So over time, we can actually have pain in the inferior aspect of the patella. So again, instead of, if you were looking at the blinky light and somebody said, ooh, I'm hurting right here on the inferior aspect of my patella, people want to poke around in that area, but you have to understand that this problem had to do with a bad popliteus in almost every situation. So the point here is at my seminar, I draw out the entire lumbosacral plexus. I'm trying to keep this as simple as I can and say, number one, when someone has lower extremity problems like knee pain, one of the key components that's overlooked is doctors don't look at the lumbar spine. And because the patient may not come in with lumbar spine pain, I don't really care. I don't really give a rip. Because I know whether they come in with back pain or not, I know that we have 5 nerves that come out of our back. 4 of those nerves control our knee function. So if we have any degeneration or damage of these nerves, we can lose the integrity of the knee joint and its mobility. We have at L2, 3, and 4, these 4 nerve roots make up the femoral nerve, which is the sartorius, and our quadriceps. The sartorius is part of the pes anterine along with the brachial. And then also off this tibial nerve, we have the semitendinosus. And this semitendinosus, sartorius, gracilis, and semitendinosus, those 3 muscles are what makes up our pes anterine. And then in the back of the knee, we actually have the popliteus. So those are the aspects that I look for when patients come into the clinic suffering with knee pain. At my upcoming seminar, let's see, the couple of things I want to promote really quickly here. Number 1 is my book, License to Heal. You can actually go online and purchase this book if you like. This is a number 1 new release on Amazon, License to Heal, What to Do When Traditional Medicine Has Failed. It is a number 1 new release bestseller on Amazon, and it's been phenomenal for my clinic. My second number 1 new release book is called Highway to Health, Your Roadmap to Depression, Anxiety, Insomnia, or to Overcoming Depression, Anxiety, and Insomnia. You can, number 1 new release. So licensetohealbook.com, licensetohealbook.com, and highwaytohealthbook.com. So
Dr. Barlow, real quick, can you tell everyone how you're using the books in your clinic to help your patients?
Absolutely. So the first thing that I do when patients, well, one of the things is I can, at my seminars, I will actually teach you about, how important it is to write a book. And I show doctors, I give them a guide to this. Okay. And then my marketing.
My cellular data was off.
Okay, somebody needs to mute their phone, please. And so what I do is all of my marketing is based on my books. All right. So I have 29 1-minute commercials on TV for my book, and then I have 1 30-minute infomercial. So as soon as the patient comes in for whatever health problem they have, the first thing is they know that I'm a number 1 new release best-selling author. And as soon as they sit down in my exam room, the first thing I do is hand them my book. And then I tell them they need to read this book as quickly as possible, because almost everything, if not everything, that we're going to be doing to you is in this book. And as soon as you're finished with that book, you need to read this one. I cannot overstate the power of becoming an author. I carry a diplomate in functional neurology. I carry a fellowship in functional neurology. I've carried those for a minimum of, it's been over 10 years since I've carried both of those, but nothing compares to actually being a number 1 new release author. And to do it twice carries a huge amount of weight for patients, because of being an authority in brain-based disorder, gut disorders, and knee. And what I want doctors to understand, this knee stuff right here, I'm sorry, I went to another page, but this knee information that I went over, I mean, this is low-hanging fruit. Every doctor needs to know this information. This is just the easy stuff. You come in, you help somebody with knee pain. And our program is, if we don't get results in 2 visits, we won't accept you for care. This program is so powerful that virtually, and I'm not saying everyone, but virtually everyone is in a 90 percentile range plus will see results in 2 visits using this technique if it's applied properly. How do I know? Because I've been doing this for 8 years using this Neural Reconnect system. I've been training doctors for 12 years. So guys, if you would, please make sure you mute your phone or your computer, because we're getting some background. Again, at this upcoming seminar that I'm having in Conroe, Texas, is hip pain, knee pain, peripheral neuropathy, and plantar fasciitis. And we're going to be attacking this from a neurological standpoint. I'm not a doctor that's going to train you on protocols. I'm going to train you on how to actually do an exam so simple that even a patient can understand it, and to do this exam and then put a patient on a program that's tailor-made for them. And what happens a lot of times with consultants is they give you a protocol, and then that's great, but what happens when the protocol doesn't work? Okay, then you've got to actually know neurology. And that's what my seminars are about, is to actually, understand the neurological aspect of what's going on with the knee, and then apply this specifically for this patient and help them optimize the recovery.
So, Dr. Barlow, we're getting close to the time. So I want to open up the floor for questions and let everyone know what the special offer is. So
Okay.
If you go ahead and you purchase NRS, which is going to be at ErgoFlex Technologies, and Dr. Barlow can kind of talk about the NeonTrack a little bit with regards to this, the NRS system, but we're actually offering $500 off if you register within the next 24 hours. And that includes anyone who watches the recording as well. And we will send this out and you'll get the contact information. You can just go to www.barlowbrainandbody.com and go to the contact information and reach out to us there. So does anyone have any questions regarding what Dr. Barlow has been talking about?
And if I could, Tony, also they could go to getfreepreview.com, getfreepreview.com. And then what this would do when you go to this is what this page will look like, and it'll kind of give you an overview of what to expect at the upcoming seminar. And also we are approved for 12 hours of continuing education. So you're going to get 12 hours. This is a total of a 20-hour seminar. You're going to get 12 hours of continuing education, which we're going to do that right up front. And then that gives us also plenty of time to do protocols, okay, or how to do the procedures, and then how to do marketing, how to do an exam. So things that you don't get continuing education hours for, we'll be able to actually use this entire 20 hours, so that when you leave this seminar, not only did you get continuing education hours, but you're going to know how to market, treat, and help patients from a non-surgical standpoint. And you will be able to do that Monday morning. And that's critically important for me, is that when patients come to my seminar, when doctors come to my seminars, they know how to actually start treating these patients on Monday, not a month from now or whenever. I mean, this is a Monday morning program.
Okay, thanks, Dr. Barlow. Does anyone have any questions? You could go ahead and unmute yourself if you have a question. Feel free to do that and ask your question and put yourself back on mute.
Well, one of the biggest questions I have while doctors are waiting is, when I'm marketing, where do I put most of my money from marketing? And that, for me, it's on TV. Now, if you're in the larger markets, then Randall is going to be a great person to go with there. And Tony, if you can put Randall's information up for marketing, that would be great as well. But where I am, I invest $16,000 a month in my marketing campaign. And so, and again, what I have is I have 29 1-minute, I call them medical minutes. And I can show every doctor actually how to do this. Okay. And it's something about TV that when you get on TV, you become like a rock star. I literally had a guy come in yesterday that told his wife, it's like, here's the movie star that you've been waiting to see. I mean, that's literally, it's like I'm not even a doctor anymore. I've been on TV so much. And then now that I have 2 number one, it's like I'm a pop star in Tupelo. All right. And that's what you want to be. You want to be the guy that everybody, it's like he's a doctor, but he's on TV, plus he's got 2 books, and we can show you how to do all of that. But again, I have 29 1-minute medical minute commercial that I do on TV. I only run them on the news spots. Like for Central Time, it would be 12 o'clock, 5 o'clock, 6 o'clock. And I run those 3 days a week and on 2 different TV stations. And I mean, it just keeps our office flooded with new patients. And that's what I want. I'm here to serve the public. I'm here to help people that nobody else can help. I do deal with tons of complex neurological disorders and I can train doctors how to do that, but we've got to start with the simple things first, and that is, how do you fix a knee problem? How do you fix a hip problem? How do you truly change somebody's life? Just not market for peripheral neuropathy, but how do you truly change somebody's life with peripheral neuropathy and plantar fasciitis? And all of this will be covered at my upcoming seminar here in Conroe, Texas, March the 18th, 19th, and 20th. So hopefully that gave somebody enough time to write a question down or.
Yeah, I have a question for you. I said, do they have to have a background in neurology?
No, you don't. I've trained medical doctors. I've trained PhDs. I've trained nurse practitioners, chiropractors. I've had massage therapists come to my clinic, and I mean not to my clinic, but to my seminars. And it's, again, I don't want to scare people off from a neurological standpoint. I have my background in neurology, so my thing is, we have to know the why. Why are we doing this? Not just a technical standpoint, or we're just turning a wrench. And it's important for me to let the doctors know this is why we're doing this. This is why we're activating this muscle spindle. This is why we're activating this Golgi tendon organ, and how it impacts the ipsilateral cerebellum and contralateral brain. But no, you don't have to have an in-depth background in neurology, but all chiropractors, all primary healthcare providers they had to go through some level of neurology, but the neurology just tells us the why behind it. Why is this working? And then why is this person getting out of pain? Why are they walking better? I'm just a big why person, not just go turn a wrench and be a technician. So the answer is no, but you're going to learn some neurology while you're here.
Okay, I've got another good question. Do they have to have the same equipment as you do? And maybe this is a good opportunity to talk about the NeonTrack.
Literally, this is no joke. To start with, this is how great this Neural Reconnect system is. All you need are your hands. Okay. Now, you would want other equipment eventually to save your hands. Just like with chiropractors, do you need all this fancy equipment to adjust people? No. But what happens is, if you don't have the equipment, what I see at seminars, I have more chiropractors that have problems with shoulder pain because they've been doing side posture and all these manual adjustments over 20, 30 years, that it wears your body out. But to start with, all you need are your hands. But eventually you would want to buy some very inexpensive equipment to help assist you with this system. But no, you don't have to buy anything. Just come to the seminar and bring these here. I'm sorry, Tony, you're muted. You're muted.
Can you talk a little bit about the NeonTrack and how you've incorporated that into NRS?
So the NeonTrack, for people who don't have the NeonTrack, that would be one of the first things I would highly recommend that you get if you're going to treat patients with knee pain. Now, with coming to this seminar, again, what we're going to be able to do is show you how to get results within 2 visits, or you don't accept the patient for care. And then in our clinic, or what I would recommend for people is, we're going to charge a minimum of $4,950 per knee. All right. And I'm going to show you how to set that up. Okay. And then also, what we want to do is we want to be able to provide the doctor with a huge source of income, but also be able to help patients. And when you can help these people and they can see that they're getting results instantaneously, almost in some of these cases, they want to pay you. So if you can serve patients in a way that no one else can, from a non-surgical knee pain relief program, you should get paid for that. And then also that avails you to buying other equipment like the NeonTrack. So the NeonTrack is a mild form of decompression, where we take the tibia and the femur, and what we're going to do is we're going to open those spaces up, and we have imbibition. Okay, remember, in these joints, tendons and ligaments, they heal very, very slowly because we don't get a direct blood supply. And one of the ways that we can get blood supply into this area is by imbibition and this pumping mechanism, this back and forth. So I use the NeonTrack with, I'm not going to say on all of my patients, but almost every patient that comes in here with knee pain, I'm going to be using the NeonTrack.
Okay. Can you hear me, Dr. Barlow?
Yep.
Yeah, okay, great. So the final question is, how much should people be charging for a knee care program?
If I will go over my care plans when I come to the seminars, and And some of my neurology programs with people with Alzheimer's, Parkinson's, and these severe cases of brain-based disorder, I can train doctors how to get to that level. But with the knee pain, the minimum, the very bottom of the barrel minimum you should be charging is $4,950 for your care, and that's per knee. Okay. Now, here's what I want you to understand is that almost everyone that comes into the clinic with knee pain, they will have a lumbar spine problem. So that's $4,950. Knee pain is $4,950. And then they've got a right and left knee pain. So what we can do is we can actually put a cap fee on it to where if you have, let's say, 2 knees, you could charge $7,961 for both knees, or you could charge $9,961 if they had a low back and both knees. So there'd be 3 areas. But I promise you, I will be going over all of this at the seminar in March the 18th. But at least we should be charging a minimum of $4,950.
Okay, I've got one more question, then we gotta bring to an end. Just to remind everyone, if you purchase NRS within the next 24 hours, you get $500 off. Go to www.getfreepreview.com. And Shelly wants to know, if you don't have a book or don't have a budget for a book, is there another opportunity that you can use for writing your own book from scratch, or maybe use the trusted advisor?
Okay. Yes. What I have here is this is called the trusted advisor piece. Okay. And with it, I'll bring this, I'll bring several of these to the seminar coming up, but it's 14 pages. Okay. And actually 15. And so what we would do here is we would actually, what am I trying to say here? Make this doctor specific.
We personalize them for your clinic.
Personalize. There you go. Thank you. Okay. Yes. This is my 3rd webinar of the day. So it's,
you're doing a great job.
That's what it is. Thank you. So we're going to tailor make this for you, for each clinic. Okay. And this is our trusted advisor piece. And what I do in my clinic is I have the Highway to Health, and I have this inside of there. And what this 14 pages are, this is kind of like the cliff notes of that book. Now, this is available for $4,500. Okay. And so what you become is you become an author of a Trusted Advisor magazine. All right. And what you do, it's something about when you tell a patient that you're an author of anything. Okay. I'm the author of the Trusted Advisor magazine. The information in here has the potential to change your life. It will optimize your recovery, but you have to apply what we're doing here. And so if you can't go all in with a book, which I can talk about at the seminar, when I have the seminar in Conroe, Texas, we have at least what we have for $4,500. You can get this trusted advisor piece, and you can give this to every single patient that comes in. And guess what? We can actually have a marketing campaign where you're the author of the trusted advisor piece on how to optimize your health and recovery for chronic pain and chronic conditions. And then you're an author of that. And then people come in, they see you, they see you on TV, you're an author of a magazine, they want to be part of that. And then they come in, you give them this. And so that would be the most cost-effective way to do it, is do the Trusted Advisor magazine. And it's incredible. It's professionally done. And every new patient that comes into the clinic gets my new book and the Trusted Advisor magazine.
Awesome. So these are great opportunities. I hope everyone enjoyed our first Q&A with Dr. Barlow live. We're going to try doing these a little bit more, so keep an eye out in your emails and your text messages. Thank you, ErgoFlex, for sponsoring this. And like I said, if you have any questions, go to www.barlowbrainandbody.com. Or if you want to check out the NRS class, go to www.getfreepreview.com. So thank you, everyone. Thank you, Dr. Barlow. Have a good night.
Good night, everybody.
Bye.